Hi, I'm Daniel Hershey's Espelita, and today I'm going to perform preparing of medication from a vial. A vial is a small glass container with rubber sealed cup, so this comes from different sizes from single dose to multi-dose vials. And there are several drugs such as penicillin that are dispensed in powder form. Thus, liquids such as sterile or saline water must be added, and this technique is called reconstitution. So moving on with our materials, we have the MAR, syringe with needle, a filter needle, aseptic wipes, and the vial. So I've already performed my hand hygiene. Next is I'm going to check my MAR and look for the medication that I'm going to need, the name, the drug dose, the route, and the time. So after that, I'm going to dispense the medication from the medication cart, and I'm going to compare the medication from the MAR to ensure that I have the right medication. So in mixing the solution, I'm going to rotate the medication through or in between my palms, in between the palms of my hands, and not by shaking it, because some drugs have aqueous suspensions, which means they can settle when they stand, and in some cases, shaking is contraindicated because they can cause foaming of the mixture. So next is I'm going to use the aseptic wipes to clean the rubber area of the vial. This is to reduce the microorganisms and to clean the dust or the dirt. Next is I'm going to attach the syringe into the filter needle. This is to remove the solid particles that is to be withdrawn with the medication. So ensure that the filter needle is firmly attached at the syringe. So now I'm going to remove the cap, and I'm going to draw into the syringe the air that is equal to the volume of the medication needed. So after that, I'm going to inject the syringe carefully onto the upright vial through the center. This is to maintain the sterility. And next is I'm going to inject the air inside the vial. This is to for easily withdrawing the medication, because the negative pressure will not be inside the vial, and keeping the bevel of the needle onto the surface of the medication, because this is to avoid creating bubbles inside the medication. So there are two types of withdrawing the medication. One is we can withdraw it with the vial on the base down, and also what we're going to do here is we're going to place the vial on an inverted level. So I'm going to place the vial and the syringe at an eye level, so I can ensure the dosage that I'm going to get, and then slightly pull to get the right amount or the right dosage. So I can eject the bubble from the syringe back into the vial. So after that, I'm going to remove the vial into the syringe and flick the syringe to remove the air bubbles. So the air bubbles will rise and it will go onto the top of the needle and it can be ejected. So still using the upright position. So I'm going to place or replace the needle into the cup using the scoop method. This is to remain the sterility. So after that, I'm going to remove the filter needle and again use the regular needle. And also again have a mark that this is the type of medication and you are going to use it onto this patient. So in preparing and using a multi-dose vial, first you have to read the manufacturer's direction, then you're going to withdraw an equal amount of air from the vial before adding the diluents unless otherwise indicated by the manufacturer's direction. So after that you're going to put add an amount of water into the vial indicated by the direction, and after that, so if the vial is reconstituted, label it with your name or your initials and the date, and also place it in the refrigerator or as the manufacturer's recommendation. And after that is you have to aftercare all the materials that you've used and perform hand hygiene, and last is to document your procedure. That's all. Thank you.